Welcome to Spotlight. I'm your host, Amitha. Join us weekly to get inspired by guests who will discuss their success stories. Today, we are holding another set of interviews, the third one, regarding the upcoming Canada-India Healthcare Summit happening virtually on May 20th and May 21st. We have the pleasure of bringing back on board Dr. Lakshmanan, the chair of the summit, Mr. Thakkar, the chair of Canada-India Foundation, and today we have the special privilege of having the Consul General of India, Srimati Apoorva Srivastava, as our guest. Welcome, Consul General. Welcome, Dr. Lakshmanan. Welcome, Mr. Thakkar.
Thank you.
I'm going to start off by asking Dr. Lakshmanan. You have been the visionary behind all these Canada-India forums. So tell us what motivated this year's summit.
Amitha, thank you very much for having us. You and Spotlight have been helpful to Canada-India Foundation from early days with our summits. Amitha, you can recognize people talk about the World Economic Forum in Davos and all that. We talk about sustainable growth, sustainable economic growth. Sustainable economic growth cannot be obtained with healthy human population. Healthy human capital is very essential for sustainable growth globally. And we all live in global village, and current pandemic challenge that we are all seeing all over the world, be it in North America or in India, is evidence how important it is to have healthy human population, how much healthcare matters to people. So we see that today, and we are fortunate, Canada-India Foundation, from early days that we have been focusing on policies, and we have had 2 conferences on healthcare, earlier in 2015 in Toronto, 2017 in New Delhi, and with our Consul General, Apoorva Srivastava's help, we decided that we'll hold the 3rd one again in Canada. It so happens that when we decided to hold the conference, it so happened that we are facing this COVID challenge, a pandemic challenge. And best is to bring the best of both countries to help together to address the challenge, how India's research and the demography and India's investment in developing technologies, commercializing. India is the pharma capital of the world, and Canada with the universal healthcare and the investment she made in universities and else is evident that the 2 countries coming together can actually participate in helping resolving the challenge that we have with on the healthcare issue. This is one reason Canada Foundation, continuing with its journey on healthcare and public policy, decided to hold the economic the healthcare summit 2021 healthcare summit, bringing the best of India and Canada, be it academic, be it government officials, be it private sector, together with our private sector in universities and also government officials, so that they'll have a platform to discuss and address the challenge that we have today on the COVID. That is the reason, Amitha, we decided to hold this conference with the help of our Consul General, Apoorva Srivastava. Thank you.
Very good timing in terms of what India is in crisis right now. So very much needed in terms of the information that we can have. So I'm going to turn to Consul General. I understand that you have been a champion and a great supporter of the Canada-India Healthcare Summit since its inception. Can you tell us a little bit more about how your office is involved and why do you think events like this summit is important to improve those relations between India and Canada?
Thank you, Amitha. First of all, thank you for inviting me for this discussion. Yeah, I'm very grateful that I have been part of this wonderful initiative with CIF and Dr. Lakshmanan from the very inception. To give you a context, India, Canada are strategic partners. Our partnership encompasses cooperation in a wide range of fields, and healthcare is one of them. And for For instance, we have a number of Indian pharma companies who have established themselves in Canada. We have a large number of Indian origin healthcare experts in Canadian universities and research institutes. Many Indo-Canadians hold eminent positions in state-of-art hospitals and health networks. So given this background, the Consulate continuously engages the stakeholders in healthcare sectors and take initiative which can help in development of closer bilateral cooperation in this very important field. And Canada-India Healthcare Summit is a flagship initiative. And when Mr. Lakshmanan told me about this, that he has already done 2 of these summits, so I kind of begged him to do the 3rd one again. And it so happened that it was all this discussion was all pre-COVID, and it was supposed to be in person, but situations change and it has become more timely. And as you see the situation going on in India, this discussion will be more timely. And I believe this will help in addressing the contemporary challenges and exploring new opportunities for expanding cooperation between our 2 countries. Though you're right in saying that I have been involved in its program from the very beginning, but I think the real credit should go to, Canada-India Foundation, the Toronto Rehab Institute, and FICCI, who has been working tirelessly and have put together such a power-packed 2-day program to make it a successful summit.
Great, Consul General. Definitely together we are stronger and we find better solutions. I'm going to turn to Mr. Thakkar. You are the chair of the Canada-India Foundation that we just heard about, and these forums have been held since 2009. Now, there is something special in terms of this year's summit in terms of new initiatives. So tell us more.
Thank you, Amitha. Great to be with you again. This time, see, Canada-India Foundation, Amitha, for the last decade and a half, working very closely, very tirelessly in promoting the bilateral ties between Canada and India. And our summits is one step toward that how we can initiate the policy discussions. And we've been, hosting conferences on various areas in the past, and healthcare is our key priority area. And this year's forum is very special. The theme is very relevant, and our theme of this year's summit is the pandemic response and initiatives, biotechnology and artificial intelligence. So this year's forum is very special. As we started our journey almost 3 months ago, we have hosted 3 webinars already, which includes biotechnology, its contribution to overcome COVID-19. We also did a webinar on pandemic responses and initiatives, also on artificial intelligence and its contribution to overcome COVID-19. So those were very thought-provoking discussion with the eminent speakers. We will be producing white papers on those discussions, which will be presenting at the forum. Also, this year's summit is very important, as we are the first time we are introducing Canada-India Healthcare Innovation Award for the young entrepreneurs.
Great. We are definitely excited too. I mean, you are trailblazers for doing this, and despite the shutdown, you're doing this virtually. And like we have already reinforced, this is very much needed, perfect timing with India being in crisis as well. So we have more to talk about the conference. I mean, the Canada-India Healthcare Summit. But before that, it's time for a short break. Welcome back to Spotlight. We are talking about the upcoming Canada-India Healthcare Summit to be held virtually on May 20th and May 21st. So team, let me turn first of all again to Dr. Lakshmanan. So we have heard about how these Canada-India healthcare, not just the healthcare forums, but in general, Canada-India forums held by the Canada-India Foundation is helping towards making the ties between Canada and India stronger. Today, our focus is on the Canada-India Healthcare Summit. So Dr. Lakshmanan, tell us a bit more about this year's summit and its speakers.
Well, Amitha, it is wonderful hearing from you such wonderful questions. Amitha, earlier conferences gave us an idea how best we can come together to help both countries. And this pandemic clearly reflects, when you talk about health, it is a global challenge. Our earlier conferences brought together people from academic world, and private sector and government officials together. We formed partnership between William Osler and Apollo, partnership from Medanta and University Health Network, and We Technologies, Sonar Technologies and University Network, and also members of Canada India Foundation, Amitha, donating a mobile hospital to southern state of Tamil Nadu, which serves to 3 districts. Every month, nearly 3,000 patients come and they wait in line to get care. So not alone the private sector, public sector contribute in the well-being of the human capital, but also civil society comes forward in what little they can do. Many drops form an ocean. So the platform, the summit that we organize, creates connections and contact to share the experience, the journey together, how we can be bringing more productive value to the global population. To reflect upon that, in this conference, Amitha, they are bringing Professor Srinath Reddy, an eminent public health policy expert from New Delhi. He participated in our conference in Delhi also. He will be speaking. An eminent doctor surgeon, Dr. Trehan from Medanta. And we have the CEO and the managing director of Bharat Biotech who's going to be talking. Krishna Ella is going to be talking. We're very fortunate. Things happen because of our connectivity, our contact, our Consul General boss, she was very generous. In life, Amitha, it's not sharing the money that is important, donating the money, but sharing the knowledge, sharing the contact. And our Consul General very graciously connected us with Krishna Ella. We have also LV Prasad, Choco, my good friend from B Technology, connected with Dr. Prasad, the managing director of Reddy's Lab. So those people are going to be contributing. We'll have Sangeeta Reddy, who was the previous chairman of FICCI. She's going to be speaking. Uday Shankar, president of FICCI, is going to be speaking. Alok Rai from FICCI. These are all eminent people from India contributing, sharing generously their life experience, how to address this challenge. But in Canada, we have the universal healthcare, strong universities, and we have people like Professor Grant Pierce is going to be participating. Our own minister, Anita Anand, she is every day she is in the media. With her experience, she is going to be a speaker in this conference. Lakshmi Krishna, she is the Vice President of National Research Council on Vaccines. She will be contributing. Dr. Kevin Smith, the CEO of University of Canada. So what you see here, Amitha, is such eminent people generously coming forward, not only giving time, but sharing their experience. So the platform that CA proudly presents is an opportunity for such eminent people to come together and plan for tomorrow's healthy human population, so that the pandemics, when it happened before. So India is well recognized, we have eminent people there, but the question is, in the virtual world, previously Satish was mentioning, we had conferences in King Edward or Four Seasons, but this one is virtual. So the platform is available, as Satish said. Everybody in the world, they can be connected with Zoom electronically, and they can listen. And it is not alone that India and Canada will benefit, the global population will benefit through this summit. So everybody all over the world can benefit, and our job is tirelessly spread the information, share the knowledge, so that the human population can benefit wherever they may be. Thank you, Anita.
Great. I mean, global change makers from both India and Canada coming together, and our viewers have that advantage. You don't have to travel anywhere. You can watch it, be part of it right from the comfort of your homes. So this is great, and amazing speakers. I'm going to turn to Consul General. As Dr. Lakshmanan mentioned, Consul General, you have been instrumental in bringing on board Dr. Krishna Ella, the chair of Bharat Biotech. So tell us a little bit more about this, and in terms of why it is important to focus on the indigenous vaccine developed in India, how ICMR and the government of India are facilitating it.
Thank you, Anita. First of all, I'm grateful to Dr. Krishna Ella, Chairman of Bharat Biotech, for accepting the invitation and attend this summit. While he'll be the right person to talk about the distinct feature of this vaccine, let me briefly say that Covaxin is India's first indigenously developed COVID-19 vaccine, which was developed by Bharat Biotech in close collaboration with ICMR and National Institute of Virology, Pune. The vaccine has attained 81% efficacy in third phase trial, concluded recently. It is, of course, a big achievement for our whole country. And also, recently, US Health Advisor Dr. Anthony Fauci endorsed the efficacy of Covaxin in neutralizing even the new variant, B.1.617 of the virus. So given that context, just wanted to add here that while India has formally approved the use of two vaccines, one is developed by AstraZeneca and Oxford University, which is being produced by Serum Institute of India, Covishield. The other which has been approved is, of course, Bharat Biotech, which we have already started administering both these vaccines in India. It's an indigenously developed whole virion inactivated Covaxin. It's again, as I told you, it is with ICMR and National Institute of Virology. But we have several other vaccines in the clinical trial stage in India. We have Sputnik 5, this vaccine developed by Russia's Gamaleya Institute, and Dr. Reddy Laboratories is conducting phase 2 and 3 trials. We have Zydus Cadilus vaccines being made on DNA platform. Also would like to mention here the Vaccine Matri initiative, in which India has supplied this vaccine to more than 90 countries across the world. And today, India is at a critical juncture in the battle against the gruesome virus. Although it's too early to say, I am very hopeful that, these vaccines will, I'm sure that these vaccines will be administered quickly, and we'll definitely get over this soon. Thank you.
Thank you, Consul General. Yes, definitely we keep hope. I mean, there's light at the end of the tunnel. The whole world is coming together for India. Plus, we just heard about these vaccines, and we'll get to hear more about them at the summit. So, Dr. Lakshmanan, since you have been the visionary for these Canada-India forums and this year's healthcare summit, I have to ask you, what are you looking to, decide that this summit will have been a success at the end?
What we want to say is this platform of summit provides opportunity for people to come and present their research or product summary, whatever it is. But the summit is not alone presenting papers and exchanging information, but also it provides platform for exchanging cards, starting new business, economic activity, growth, so companies may be formed, whatever it is. But beyond that, Amitha, as Satish said, we recognize, as TAI has been doing, that encourage how important, because I'm an academic teacher, EFT, but also I have my own company. We also know how important it is to get the seed capital when you have a new idea to commercialize. People always ask, what is the return? But you want to have investment to prove the concept. So Canada India Foundation has come forward with working with the contacts as well as themselves to give 5 awards for young entrepreneurs to prove the concept. So this conference is uniquely taking shape, not alone bringing people to make presentation of their research work or their experience constructing, commissioning a plant, but it also will encourage youth in terms of taking the ideas to marketplace by supporting them with our innovation awards. Also researching, just like other communities have done, because if government and private sector alone cannot be doing, the civil society has to contribute its own share. And Canada India Foundation for many years, it has been doing. When we had the COVID, the Canada India Foundation took food to many hospitals, police, frontline workers, and everybody. At the peak of the conference, peak of the COVID, Canada India Foundation was there with a local restaurant owner. We went and contributed food to everyone. And so we continue to engage with the community, being an active participant with the civil society. So our engagement doesn't stop only with arranging conferences, taking the white paper to the government agencies as a submission to our agencies, our authorities, for them to study our recommendation, but also engaging, planning for the future. The youth is our future. So supporting the youth and also thinking about establishing an endowment for healthcare, focusing on diabetes, kidneys, cancer, and heart attack diseases, non-communicable diseases, which affect South Asian population more than many other communities. So this is a little contribution beyond the summit along with the summit, we continue to be doing. This is the course of our journey, Amitha.
So beyond the summit, I mean, seeing that this goes into the community, people getting involved and changes in policy to make the community and the relations between Canada and India better, and that will mean success for the summit. I do foresee it happening as we have seen over the years. So we have more to talk about the summit, but before that, it's time for a short break. Welcome back to Spotlight. We are talking about the Canada-India Healthcare Summit taking place virtually on May 20th and May 21st. At this point, I'm going to turn to Mr. Thakkar. We understand that there's going to be a special announcement at this summit. Would you be able to tell us a little bit more about the details?
Sure, Amitha. Before that, I must commend Dr. Lakshmanan. He's a great champion in steering our various forum, and I must applaud his energy and his passion, which is infectious. And over the planning phase, we sat quite a few times to kind of a brainstorm on the ideas like how we can make it more sustainable. That conference, when it ends, it doesn't finish there. It doesn't kind of translate into the papers and being presented to here and there. How we can continue that dialogue further. So one idea we came up with was creating a research fund. Amitha, you know that integrated health, holistic health, it's kind of become the buzzword today, right? The principles
Absolutely.
of our traditional holistic health and the current practices of the Western medicine, that how we can integrate that to bring the better care, which is based on the plant-based diet, physical exercise, yoga, meditation, mindfulness, how to alleviate stress. These are the key area that how we can innovate today's healthcare to bring the best of the best, care for whether it's a disease prevention or a disease management side. So we have come up with an idea that we will be creating a large pool of research fund, which we'll be announcing at the conference. The dollar figure I will not announce it today, and because we are just formalizing that arrangement with the UHN. As you know, Toronto Rehab, Toronto General Hospital, which is part of UHN, and I must say it here that Toronto General has been rated as number 4th in the world and number 1 in Canada. So very, very credible institution, and they have a track record of their, carrying on the research. So we are partnering with them, and we will be partnering. Special thanks to Consul General, who has provided unstinting support to this conference, and that we will be working with the Ministry of Ayush to have a collaboration with the UHN, and to fund that, we are creating a research fund to have a research done into as 4 key areas. Dr. Lakshmanan mentioned diabetes, heart disease, chronic kidney disease, and cancer. That how concepts of Ayurveda or Eastern wisdom can be combined with Western medicine and bring very innovative ways of delivering the healthcare service. So those are the ideas we are kind of working on, and it would be a long run project, and we are getting a community involved into this, and we are looking forward to have a very successful model. I think this would be the first of its kind in North America, and we are very excited about this announcement we'll be making at the conference, and we're looking forward to serving the community into one of the best way, as we all know that health is wealth. If you are
Absolutely.
and the health is not only the physical health, it's also your mental health, your spiritual health. So if we are healthy, all other things follow. So we're looking forward to this announcement greatly.
Well, holistic is the way to go, to live a wholesome life. So this is great. And we feel privileged that we got to hear about it first. So we'll get to hear more about it at the summit. So this is great. The Canada-India Healthcare Summit is going to be an amazing experience for everybody who's going to be part of it. And thank you to Consul General and your office for supporting this great cause at such a critical time we have right now as India is in crisis. I'm going to ask you, Consul General, what do you think needs to be done more in terms of, making these ties between Canada and India better in the healthcare sector?
Thank you, Amitha, once again for this question. I think, healthcare is one area where the potential is enormous, we have 1.6 million Indo-Canadians, as I said earlier, who have been very active, in the Canadian health corridor. If you see experts and Indian origin healthcare experts in Canadian university, research institutes, in hospitals, in Indian pharma companies here. And of course, when you look at CIF and Dr. Lakshmanan, these, people like these have been facilitating this interaction. But of course, a lot more could be done. There's with Canada having a highly developed ecosystem for development of high technologies and biotechnologies and healthcare sectors, things, startup spaces like Mars, there's a lot of startup spaces where we can collaborate with India, and the beginning has been done, by this 5 awards which has been announced by the summit. Similarly, of course, this vaccine, of course, for vaccine creation, production, Canada can be a good position for, vaccine production also. So many things can be, there's a lot of enormous potential, and this Canada-India forum, is, I think, the right way to, they will give us a lot of ideas on which we can work upon as governments, as Indo-Canadians, the experts, and we are waiting for the experts to, spell out various details of what more can be done in this India-Canada corridor. As you know, we are strategic partners. We are both democracies. We are ready to help each other. We are supported by 1.6 million Indo-Canadians. So all the suggestions will be happening. The potential is enormous, and we are very happy to. We'll be very happy, and we'll be honored to take any steps to increase this collaboration.
Well, thank you very much, Consul General, especially today for taking time out of your busy schedule and enlightening us more, not just about the summit, but in general about how Canada, India can get better in terms of their ties. Thank you very much, Dr. Lakshmanan and Mr. Thakkar, once again, for coming on board and enlightening us about the summit itself. So we are very excited about this on May 20th and May 21st. We wish you all the best. I'll be there, and I know our viewers will be there too.
Thank you.
Much. Thank you.
Thank you.
Thank you.
So we just heard from Consul General Dr. Lakshmanan and Mr. Thakkar about the upcoming Canada-India Healthcare Summit brought together by Canada-India Foundation, FICCI, and UHN. Well, that's a wrap for this week's show. Thank you for watching us. Continue to follow us on Facebook and Twitter, and write to us at spotlight@ethnicchannels.com. Until next week, this is Amitha signing off, encouraging you to be part of the Canada-India Healthcare Summit.